Hi, Angad.
How nice to see you. How are you doing?
Good to see you too, Angad.
Are you in Delhi?
So glad you're part of this presentation.
Thank you. I'm glad we could make it happen. 10 minutes to share a lot of information.
Nine.
9. Okay, I'm going to aim for 6.
Is it 9?
It's 9.
You know, we're trying to be efficient here. So
I'm glad. We've circulated the decks, I think. We're going to try and smash through as fast as
I
possible.
can't hear him. There's something, it's very soft. It should be louder. I won't be able to hear. Angad, can you speak again? So we're testing if I can hear you.
Sure.
Oh, no, now I can hear you. Wonderful. You know, this is a good test that I got into a conversation with you.
I know.
You know, this, I won't be able to make out from here. It's too far, one, and two, normally on my iPad, I see who all are attending.
Hi, everyone.
Hi.
Hi, this is Kanish from Girl Effect.
Hi, Kanish. This is Poonam Mutreja.
Lovely to meet you.
Okay.
Hi, Kanish. This is Angad.
Hi, Angad. I can see you.
As well.
How's it going?
It's going okay. Not too bad, all things considered.
Yep.
Enjoying your Instagram feed.
Thank you. I haven't posted in a week. I better up it a little bit now.
That means you haven't had anything come home.
It's like Qureshi's there. Hello, Mr. Qureshi.
Zoom nahi, Microsoft.
Desi Raju, sir. Can we start on time? Unlikely, yeah? So let's go. But Mr. Agnani is not there. Is that?
मैं हूँ.
Oh, maaf kariyega. I was waiting for you. I'm sorry. Agnani Saab, very, very warm welcome to you. And thank you for always supporting adolescents, women's health, and all causes, and joining us and sparing the time when you're so busy. So with that, welcome to Mr. Agnani. May I please, let's start the proceedings for today. I'm Poonam Mutreja, and I work with the Population Foundation of India, and it is a great privilege to have all of you. And I want to welcome the chair of our board and former Secretary Health, Mr. Keshav Desi Raju. Thanks for being with us. This is a very short and sweet program. We have 1.5 hours to make 4 presentations and have a panel, but we believe we are not foolish, we are efficient. So we will try and do our best to finish on time and be as efficient as possible and sharing the 4 wonderful studies that tell us a little more about adolescents during the pandemic and after the pandemic started. So as the world grapples with this unprecedented challenge posed by COVID-19, young people are amongst the most affected by the pandemic, not just socioeconomic impact, but also if we look at the kind of anxiety and mental health and their lack of being settled at this point of time brings or is creating, well, the majority of the government's policies have quite rightly focused on the older people who are more at risk and so on. It is time that while we pay attention to the older adults, we also it is imperative to comprehend and begin to address pressing the problems of young people. And that's why we are all here today. So with this objective, on the eve of International Youth Day, to welcome to the National Dissemination Webinar on Emerging Adolescent Health Issues during COVID-19. So today's webinar is in two parts. The first part has 4 studies, 2 done by PFI and 2 done by our other partners, though they were not done in partnership with us, but it is a proud privilege to present the work that they have done. So we will be sharing these 4 presentations with you because 4 of us together make a body of knowledge. And also it is time for collective action in more ways than one, working closely with the government, working in partnership with other NGOs, and working in partnership with communities. So from till 3:35, we will have we will have 4 studies presented, and the presentations will be followed by a panel discussion where we have been joined by Dr. Agnani, Joint Secretary, RCH Ministry of Health and Family Welfare, Dr. Eric Munro from Children's Investment Fund Foundation, and Manik Matiani from the YP Foundation, and Kanishk Kabiraj from Girl Effect. We hope that the recommendations emerging from these 4 studies, as well as the consultation we are going to have today, will provide insights and action required to address the needs of adolescents. Before we move to the technical sessions, we are going to present to you the premiere of a film called Kishore Avastha Ke Sawal. It's a 5-minute film capturing the experiences of adolescents. We do not have adolescents joining us today, but I feel young, and many of us feel young as adolescents, but we don't have them with us. As we navigate their transition from childhood into adulthood is what the film is really about, and it is based. Please. My voice is echoing. Technical support needed here. The film highlights, among other things, the experiences of young people and peer educators who are part, as you all know, of the Rashtriya Kishori Swasthya Karyakram, which is a government program for adolescents rolled out across the country, and the counselors and the impact that access to correct information has had on their lives. So let's watch the film, 5 minutes.
जैसे सेक्स है, अब उसके बारे में ऐसे कनिष्क क्या होता है?
क्योंकि हमें ये समस्या थी कि मेरे माँ वाली नहीं आई थी उस टाइम पे।
जो मेरे पहले बार सपना दोस्त हुआ था ना, तो मैं उस रात को सो रहा था। सोने के बाद अजीब सा गंदा सा सपना आया उसी लड़की के बारे में जो मेरी गर्लफ्रेंड थी। सुबह उठा तो चेडी खराब मिली मेरे को।
बहुतों को तो घर परिवार का मानसिक तनाव होता है, किसी को जैसे मतलब शारीरिक संबंध बनाते तो वो मानसिक तनाव होता है, किसी को पढ़ाई से रिलेटेड मानसिक तनाव भी होता है।
नींद आती थी और चिड़चिड़ापन महसूस होता था और दर्द भी होता था, उसके साथ कुछ खाने की इच्छा नहीं होती थी, शरीर पूरा टूट सा जाता था, बस जैसे सोए रहो एक जगह।
इनके जब माँ वारी आई तो इसकी मम्मी को इसने बोला था, लेकिन उसने कुछ संकोच के हिसाब से उसने मेरे को बता नहीं पाई।
मेरी मम्मी से थोड़ी बोल सकती हूँ डायरेक्ट, मेरे साथ ऐसे प्रॉब्लम जैसे मेरी उम्र की है ना, तो मेरे से तो आराम से बात कर सकती है।
जो एडोलेसेंट है, अगर हम नहीं होते दीदी आशा से नहीं बोल पाते तो अपने जो क्लास के फ्रेंड हैं या अपने बराबर के दोस्त हैं गांव में, तो उनसे भी वो शेयर करते हैं।
कि लड़के ना ये ऐसी जानकारी के लिए भाई यौन संबंध कैसे बनाना चाहिए और माँ लड़कियाँ देखनी माहवारी क्या कैसे आती है, इनमें क्या क्या बदलाव आते हैं, तो इसके बारे में वो मोबाइल में सब कुछ जानकारी ले लेते हैं।
बहुत सी बार क्या होता है कि जैसे नेट में चीज़ें देखते हैं तो वो प्रॉपर मतलब सही नहीं होती हैं, तो सही मार्गदर्शन सही जानकारी के लिए काउंसलर का होना बहुत ज़्यादा ज़रूरी है।
राजस्थान में ज़्यादातर ये जो कॉन्डोम वगैरह होते हैं इनको बहुत कम यूज करते हैं, और लड़कियां भी टैबलेट्स वगैरह बहुत कम, मतलब इनको किसी प्रकार का डर नहीं रहता है कि गर्भधारण हो जाएगा। इस प्रकार का समाज है।
मैंने अपने दोस्त से जाके पूछा, भाई पता नहीं यार ये सुबह सुबह क्या हो गया, तो उसने मेरे से बोला, भाई ऐसी कुछ भी बात नहीं है, तो घबरा मत, तेरी उम्र हो गया ना तो तेरे साथ चलता रहेगा।
फ्रेंड में, ग्रुप में ये जानकारी प्राप्त करते हैं तो आधी अधूरी जानकारी उनको मिलती है।
कोई लड़का कोई लड़की एक दूसरे को पसंद करते हैं, उनको कोई प्रॉब्लम हो जाती है या उनको कोई यूज़ करनी है तो उसके बारे में हम प्री एजुकेटर से सलाह ले लेते हैं।
कुछ लड़के ऐसे आते हैं तो उनमें क्या है, जैसे कि गुप्त अंगों में बाल आना, और जो रात को सोते हैं तो वाइट जो निकलते हैं उसके बारे में हमारे से चर्चा करते हैं कि ये क्या हो रहा है, मेरी बीमारी तो नहीं है। उनको यही सलाह देते हैं कि भाई ये किसी प्रकार की बीमारी नहीं है, ये तो मानसिक बदलाव है जो हर एक बच्चे में होता है।
पीयर एजुकेटर को 2 सेशन के दौरान जो भी प्रॉब्लम आती है तो वो वहाँ पे एएनएम दीदी से डिस्कस करते हैं। तेरह से 14 साल में शारीरिक संबंध बना रहे हैं, अफेयर चल रहे हैं।
12-13 साल की उम्र से शुरू हो जाती हैं।
अफेयर नहीं चल रहा है तो और चिढ़ाते हैं। अगर हमें हमारे साथ रहना है तो सिगरेट पीना ही पड़ेगा, ड्रिंक करनी ही पड़ेगी। बहुत एक्स्ट्रा सोचते हैं बच्चे, मानसिक उनको प्रॉब्लम भी होती है। उनके लिए ऐसी सुविधा होनी चाहिए ताकि वो वहाँ जाके उनकी समस्या को बता सके। जो 10 से 19 साल के किशोर किशोरी हैं उनसे स्वास्थ्य संबंधी बात करते हैं, मेंस्ट्रुअल प्रॉब्लम के बारे में, सफेद पानी के बारे में, सैनिटरी नैपकिन के बारे में, परिवार नियोजन के साधन के बारे में, शारीरिक संबंध के बारे में बात करेंगे। शारीरिक बदलाव लड़के और लड़कियों में, पोस्टर मेकिंग प्रतियोगिता करवाते हैं, वाद विवाद, प्रश्नोत्तरी प्रतियोगिता, गुड टच बैड टच के बारे में हम बताते हैं, एक्टिविटी करके बताते हैं, यौन शोषण के बारे में बताते हैं, यौन शोषण कहाँ हो सकते हैं उनके बारे में बताते हैं।
जानकारी देने से तो इनका आगे भविष्य बढ़ेगा, इनको पता भी तो जब भी रहेगा।
कोई समस्या होती है तो उनकी जानकारी तो होना चाहिए ना। अगर जानकारी होना चाहिए तो उनका ट्रीटमेंट भी आप शायद समय के अनुसार ले सकते हैं।
वो एक दूसरे से जुड़े होते हैं तो वो सभी अपनी अपनी बातें बताते हैं। भाई माता पिता को तो नहीं बता सकते पर अपने दोस्तों से बता सकते हैं।
इस दौरान बहुत सारे परिवर्तन आते हैं, बहुत सारे क्वेश्चन इनके दिमाग में आते हैं। इनको जानकारी होना जरूरी है क्योंकि इनको जानकारी होगी तो इनके फ्रेंड को या रिश्तेदार को या किसी को भी कोई भी समस्या आती तो कम से कम ये उनको समझाएंगे तो सही ना।
Thank you for watching the film with us. This film was made before the pandemic started, but we thought their voices had as much relevance and it resonated in the research that we are going to prevent. So I would now very quickly move on to the 4 studies, but I do want to mention 2 housekeeping announcements. First, that we have the chatbot open. So please feel free to ask your questions on the chatbot, which will be conveyed to the speakers who you identify as people who should answer your questions. And if we are unable to answer all the questions due to paucity of time or too many questions, we will ask the presenters to respond to you. We will get back to you. We will facilitate the responses. And so now, without taking any time, I would like to invite the first presenter, Dr. Sangamitra Singh, who's a health scientist with and a senior manager, knowledge management and partnerships with Population Foundation of India. Sangamitra, please, let's hear your presentation. You kick off the presentations. And you know you have 9 minutes and you'll be given a warning 2 minutes before your presentation ends.
Thank you, Poonam. Good afternoon, everyone. PFI conducted a study, a rapid assessment telephonic study to assess the impact of COVID-19 on young people in 3 states, UP, Bihar, and Rajasthan. The primary objective of this study was to understand the level of knowledge and attitudes and perceptions of young people, as well as the impact of the pandemic on young people and the emerging needs and priorities. The study employed purposive sampling. The respondents belonged to districts from these 3 states where PFI is already working with NGO partners. Respondents were in the age group of 15 to 24 years, both male and female respondents. And we chose respondents who had phone connection or access to a phone through some family members, since this was a telephonic assessment. The data was collected from 800 odd respondents over a course of 1 week, from May 18th to 24th. Now I'm going to move to the key findings. We found that the awareness level of young people on COVID-19, at least recognizing 2 symptoms of the disease, was very high. It was at 89%. Almost all respondents were aware of the preventive practices such as hand washing or covering their face, which was imperative to avoid the disease. The major source of information on COVID-19 for young people was television at 61%, followed by 49% respondents who were gathering information from face-to-face interactions with frontline workers. About 5% of the respondents said that they had experienced COVID-19 symptoms and had subsequently consulted a doctor. As far as case management was concerned, about 91% of respondents said that they would self-isolate themselves or 88% of them sought medical care, while 92% said that they facilitated contact tracing. Moving to other findings, one of the prominent findings from the study was that 42% of the respondents experienced an increase in workload. Out of this, about 52% respondents were adolescent girls, as opposed to only 22% adolescent boys. This is also in line with a number of other studies, not just for COVID-19, but previous outbreaks, which have shown that there is a double caregiving burden on women as opposed to men. More females, about 26% females compared to 19% males reported that they had witnessed fights and domestic violence during this period of lockdown. As far as mental health issues were concerned, 22% female respondents and 24% male respondents, they reported feeling depressed. This was also more prevalent among respondents who were more than 18 years of age. There was also an increase in watching television viewership, as well as social media usage. 64% respondents who normally watch reported an increase in watching TV, as opposed to 46% respondents who said that their social media usage time had increased during the lockdown period. 65% of the respondents said that they had been in contact with a frontline worker with regard to some health information and service. Out of these, ASHAs were the most contacted frontline workers. 58% of the respondents were aware that frontline workers were providing information on family planning counseling, although 70% of the respondents were not aware that frontline workers were also providing contraceptives. There was a high unmet need for sanitary pads, especially among women under 18 years of age at 58%, in comparison to 51% of women above 18 years of age, who also reported an unmet need for sanitary pads. Only 31% of adolescents confirmed that they had received iron and folic acid tablets during the lockdown. This could also be a consequence of schools being closed during this period. 55% of the respondents said that they had access to information on mental health, and more women, 60% women as compared to 47% men, were aware of information on mental health issues. The most access sources were face-to-face interaction with healthcare providers. And only in Rajasthan did we see that 35% of the young people were using phone helplines. Phone helplines were not so popular in the other 2 states. So to sum up the main findings from the study, there was definitely an interruption in access to essential health services, including access to reproductive health services owing to the lockdown. Young people have expressed the need for mental health care services, and those who used it during this period, they found it to be positively influential. A greater proportion of female participants reported an increased domestic workload during this period as compared to their male counterparts. Some men reported being anxious about economic fallouts of the pandemic as well. The study makes a number of recommendations, primarily to promote health education and public health messaging, especially to make sure that the vulnerable populations as well as the rural communities are reached. There is a need for capacity building of frontline health workers. They are often the only point of contact for the rural population. So it's very important that their capacities are built and they can act as a solid source of information for rural populations and young people. There is a need to prioritize reproductive health services and ensure that essential health services are not compromised because of disaster situations like COVID-19. There's also a need to invest in novel social and behavior change communication strategies to not just promote healthy behaviors, but to also challenge and change social norms, which have a direct impact on women's access to health services, especially during such situations. We need more mental health services and resources, particularly catering to specific populations like women, victims of violence, young people who are experiencing all kinds of anxieties during such situations. And finally, the education institutions, they need to foster deeper connections and interactions with young people, which go beyond just academic sessions. That's it from me. Thank you.
Thank you, Sanghamitra, and thank you for doing that very quickly and on time and stressing clearly it did come out that young people need mental health services, or should we say mental health well-being. And you'll be very glad to know that we have Dr. Vikram Patel attending the seminar at this point of time. So your message would have gone well to him too, who clearly leads the work globally and in India on mental health. May I now invite you, Dr. Angad Chowdhury, who is head of Quilt AI, to present the findings of their study on the impact of COVID on adolescents, reproductive and sexual health, girl capital, and air quality and trends online. We are so glad that you agreed to join this forum and give strength to this seminar. Thank you very much. Angad, please, your presentation.
Thank you, Poonam. Glad to be here. The impact of COVID-19, as we know, has rippled across the world, confining people to their homes, closing schools, driving up unemployment. One of the interesting things we've noticed is in India, a side effect of all of this is that the digital revolution is being catalyzed, and the base of internet users is expected to increase from about 500 million to 640 million by the end of 2020. What Quilt does is it takes data from the internet and uses machine learning and cultural intelligence models to provide insight to various people. We've discovered that, of course, people are turning to the internet for information and entertainment during this period. But also it reminds us that the internet is a very powerful mechanism to reach and connect with people online. This is especially relevant for a younger audience, which is more likely to not only be online, but also use it as a space to explore, understand, and discover and assert their identities. So I'm going to very quickly walk you through some of the findings. What we did is we looked at all search, social, and conversations and uploads for about a 1-year period across 4 states at a city, district, and village level. We looked at multiple platforms such as Facebook, Instagram, Twitter, TikTok, YouTube, ShareChat, and HelloChat. Overall, we looked at north of 10 million unique data points across all of the forums. Given that we have a short amount of time, I'm just going to read out some key headlines and findings from this research. The first one I want to talk about is that access issues are, of course, coming back, and we are seeing search spikes for sanitary pads, tampons, and period pain relief across districts. We found that searches for pads have increased by roughly 30%, while tampons have increased by 170%. There has been some push by NGOs and brands to distribute sanitary products offline and to raise awareness of barriers. We've also noticed that a lot of the search demand for pain relief that we were suggesting here is driven by city level girls in UP, Rajasthan and Jharkhand. There is an increase in search around information on unwanted pregnancies that is happening, and demand for at-home abortion methods had surged since the last quarter, with about 48% increasing on a city level and about 14 to 15% increasing on a district level. We found that abortion pills are most commonly searched method of home abortion even post-COVID. Some brands, particularly RU486, and the side effects associated with that have been increasing. We've also seen, while social media, NGOs and independent agencies trying to raise awareness on the need for abortion, there's also informal advice on carrying out home abortion services across these regions. Demand for birth control has slowed down since January 2020. Condom interest has dipped by about 17%. Interestingly, withdrawal method has increased by about 20%, in particular in Maharashtra, Rajasthan, and Uttar Pradesh. The news coverage here is trying to demystify and talk about condom sales dips and linking that to restricted movement. We're also seeing, this is a bit of an interesting finding because we're also seeing a decrease in search in city level for violent sexual content, but some amount of uptick in towns and searches from February 2020 in violent sexual content. In terms of girl capital, the impact of COVID-19 lockdown measures has, of course, overshadowed many long-standing issues such as girls' access to education, women's access to employment opportunities, etc. And school closures have had an impact on both genders. And we are seeing both here in search as well as anecdotally that the push for girls' enrollment is no longer top priority. There's been a gradual decline in search interest for girls' schools over a long period of time. And we have seen the biggest decline in Uttar Pradesh. Of course, rising unemployment is a main concern, both men and women. Men are searching increasingly for remote work and women are prioritizing home care over job seeking. We are also seeing that, from a conversation perspective, there is increased social commentary around rising unemployment and the lack of financial support from various institutions, and Twitter and share chat and such forums are becoming amplifiers. We're also seeing that small businesses have been impacted and female business owners are facing loan repayment issues. Searching for business loans by women were on the rise, peaking in Jan 2020, but fell fairly aggressively right after COVID by max 41%. Mainly regional news is speaking about loan repayment along with the issues that female business owners are facing. Global news spotlights a slightly different story, but regional news is really focusing on that. We've noticed a fairly strong, the interest around upskilling has also dropped across cities and districts. Interest in vocational courses was stemming mainly from cities, while districts were showing interest in sewing, and everything is pretty much down. This is an interesting piece of information where we're finding that searches related to domestic abuse has spiked across cities, with women searching for help. What do I do if I'm beaten? What is the hotline that I can access, etc. This has increased materially as well right after COVID, and it's been pushed in Mumbai, Jaipur, and Lucknow. And while there has been a huge surge in online activism to domestic abuse cases, outrage tends to be less visceral compared to rape murder cases, as these reports are less graphic. If you have time, I'll just give you some findings on air quality. We find that, of course, while air quality interest is seasonal and driven by news coverage, that is fundamentally the pattern we see. But post-COVID, we've seen that tangible improvements in air quality has lessened the concern for the impact on air pollution and health. Since I have about a minute left, what I'll do is quickly give you some highlights on what is happening on social media across the young people. On Facebook, we see news, community support, and NGO-led conversations dominating. So there's a certain tone and genre that young people expect on Facebook. On Instagram, we see a lot of content on family life being generated and how they are trying to navigate and stay active during this period and what their plans are going forward. On Twitter, we see that there's, of course, a fairly political skew, and that's the narrative that that has to be followed. On YouTube, there's entertainment. On TikTok, it's no longer relevant. On ShareChat, we see some amount of religious wisdom happening, and on Hello Chat, we see celebrity fandom and meme style content. So overall, our recommendations are like, while we expect to have access, give adolescents access to accurate information, and we have to be aware that what is happening offline is also being reflected online. In order for us to build appropriate interventions, we need to know the nuance, the logic, and the genre of the channels in which the young people find themselves. Thank you.
Thank you, Angad, and thank you for taking the time to give us the good news about air quality. So even if you were going over your time, we wouldn't have stopped you. So that's good news. And, at a time when we have very little evidence, even though we know domestic violence is increasing, clearly your methodology has given us indications on the increased searches, and that NGOs are leading the conversation is another very good news for those of us in the NGO sector online. Thank you very much. And now I'm going to invite my colleague, Alok Vajpayee, who's Head of Knowledge Management at PFI, and Ms. Vasudha Chakravarti, who's co-founder and partner of Development Solutions, to present the third study, the impact of COVID-19 on availability and access to health and nutritional services for children, women and adolescents. And I do want to say that this study was led by, conducted by Development Solutions, and we partnered with them, and we are very happy to have you with us, Vasudha, co-sharing this presentation with Alok. Please, over to both of you. By the way, Alok, Sangamitran are all in the same office, but we are doing social distancing, so we are sitting in different rooms.
Good afternoon. Vasudha and I will present the findings of the rapid assessment that was undertaken by Population Foundation of India and Development Solution in partnership in 5 states of UP, Bihar, Rajasthan, Jharkhand, and Odisha. Let me first share the objectives and methodology of this study. The rapid assessment was conducted to understand the impact of COVID-19 and the preventive lockdown measures on availability and access to health and nutrition services for women, children, and adolescents in rural areas in 5 states. The study specifically looked at the availability and access to services, health and nutrition services in outreach provided by frontline health workers, availability and access to facility-based services, and finally, availability and access to products and commodities such as IFA tablets, sanitary pads, and contraceptives. The rapid assessment used the mixed methods, which comprised of review of the government orders, advisories, and media alerts. A phone survey was conducted with 263 frontline health workers, including 67 ASHAs, 126 ANMs, and 70 Anganwadi workers. The detailed qualitative interviews were conducted with 45 frontline workers, 10 NGO organizations, and 20 community members, including 10 women and 10 adults and girls. The selection of states and respondents was purposive in nature, restricted to the areas where our partners could support the phone interactions with the frontline workers and the community members. So the findings of the study are cannot be generalized. These are basically the insights and the perspectives of the respondents in this study. The next few slides will have the study findings that Vasudha is going to present. Vasudha, over to you.
Thank you so much, Alokji. So as he mentioned, I'm going to quickly take you through the findings of the study. So I'm going to begin with what were the outreach services that were available. And this is based on phone interactions with frontline workers. So basically, following the announcement for the lockdown on 23rd of March, on 14th April, there was a GOI advisory issued, which recommended a deferment of outreach services. So essentially, it was recommended that ANC services, etc., be provided at sub-centers and PHCs, ensuring social distancing and hygiene norms. It was recommended again that immunization be provided at a facility level, and if not possible, catch-up rounds could be done later on. So basically, consistent with the national guidelines across the 5 states, we saw that outreach services had been suspended. VHNDs were no longer being done. Orissa was the only state where, while the traditional VHND was not being done, ANMs and ASHAs were actually visiting households to provide services. So there was a roster being made, and every ANM was coming to a village level to provide services. Again, as you can see from the table, in the absence of VHND, access to ANC, immunization, and health products and commodities was significantly affected. ASHAs actually told us wherever feasible that they were following up on phones, especially women who were just about to deliver, so that in case they're ready for a delivery, they can accompany them. Health products in the 3 states of Jharkhand, UP, and Bihar, just about 5% frontline workers told us that they are able to give sanitary pads. Access to contraceptives was only those who were coming to the frontline workers and asking for contraceptives were actually given contraceptives. The new supplies were not coming in. In states like Rajasthan, there was significant civil society support to enable some sort of access to pads. Nutrition support was something that was sort of well done across states. There was a focus on ensuring that with Anganwadis being shut, both pregnant women and children are getting a dry ration, and this was reported across the states to us. In some states like Jharkhand and UP, supplies were an issue. If you could move to the next slide, Alex, please. Thank you. So in the absence of access to services and the absence of availability to outreach services, essentially those who had private transport and those who could afford to hire private transport were going to health facilities, be it PHCs or private. In states like Bihar, they told us that access to RMPs had significantly increased because they were coming door to door asking if people wanted services. Immunization, across states, nearly 80% plus frontline workers told us that people are not accessing immunization in the absence of outreach. Health products and commodities, where women and girls could afford to, they were buying sanitary pads. Many said that they switched to using cloth. And again, as you can see, the quote there from a woman in UP that they had not really seen the ANM in a while. It was also a challenge for the ANM to travel to the villages. Next slide, Alokji. Thank you. So health facilities were essentially open. As you can see, 70% plus frontline workers reported sub-centers, PHCs and CHCs to be functional. but the focus was on COVID care, on emergencies and institutional deliveries to the near exclusion of other sort of services. People were also essentially very, very apprehensive accessing government facilities because they're perceived as COVID centers. There's fear that if you actually, if you go to a facility, you're going to get COVID. Even among the few who actually access services, their experiences were not great. So for instance, in Rajasthan, one of the respondents told us that, they were unable to even walk inside the PHC. The doctor sort of looked at them through a window. And so they were very dissatisfied with the service. And so they were going to another local provider. Next slide, Alokji. Thank you. So essentially, it's the frontline workers who form the sort of backbone of the outreach and even accompanying women and young people to facilities to access healthcare. And so the frontline workers were essentially reported to us that they've been significantly pulled into the COVID response at this point. They are doing a significant role, which involves, doing surveys to assess, which are symptomatic cases, to add surveys of migrants that are coming back. They're providing information and awareness. They're providing support to establish quarantine centers at the panchayat level. They're also monitoring any cases who are positive. So they're going day after day to households. In some states like Bihar, they also told us that ANMs have been put at police checkpoints to sort of help with scanning of people who are coming into the state. In addition to all of this, they also have to ensure that they are continuing to provide whatever bit of essential health and nutrition services that they can. And so if you could move on to the next slide, Alokji. Thank you. So they're essentially working in a lot of duress and they're facing significant challenges. So some of the challenges that they reported to us, one was lack of cooperation and support from the community. So essentially what they told us was even people who knew them were now apprehensive of them coming to their house because day on day they were doing these surveys and going to different households. So they were rather seen like carriers of the sort of COVID. And so many people were apprehensive about them coming home. There was lack of safety and personal protective equipment. Many of them said that they had got masks, but supplies were limited. They had got them once or twice. And then after that, they had sort of themselves started making masks at home. There was transportation. This were transportation challenges. This was more for Anganwadi workers who had to supply nutrition at home, take rations. So, it was difficult for them to carry it, especially to faraway hamlets. There was, of course, excessive workload given the whole bunch of roles that they're performing. And then the delayed incentives. So while many of them said that incentives usually come with a lag, but it was more difficult at this point because in many of their households, their husbands and other family members who were migrants and others who had lost jobs were coming back. And so, there was significant reliance on the sort of money that they were making. So on the whole, frontline workers were significantly facing several challenges. Thank you. I'll hand it back to Alokji.
So with regard to impact, I will quickly share some of the key findings because now the time is over for us. With regard to impact of COVID-19, the perception was that there will be adverse health outcomes because of limited availability and access to healthcare. The frontline workers expressed concerns about the missed immunizations and limited supply of contraceptives would lead to unwanted pregnancies and abortions. There was also a concern about the livelihood and income. The increase in borrowing and lending was reported during the survey. The government has provided ration and income support through Jan Dhan Yojana, but not everyone has access to ration card or Aadhaar cards to access these benefits. In such a scenario, the concerns were expressed about the inequitable distribution of available food that could affect the nutritional status of women and children. The education among the children were affected with the schools being closed for extended period of lockdown. And adolescent girls expressed concerns and apprehension that probably they might not get back to school post lockdown. Increasing incidents of domestic violence were also reported by some ANMs who said that they come of such cases when women approach them for first aid or treatment. So they fear that there may be many more cases. And of course, finally, mental stress and anxiety increased. Being at home, no opportunity for income, risk of unwanted pregnancies, lack to access healthcare and education, and fear about the future. This affected men, women, and adolescents alike. To summarize the key takeaways from the study, overall access to health services in outreach and facilities were affected. Supplies and access to commodities such as sanitary pads, contraceptives, and IFA tablets were affected. There were concerns about loss of livelihood, income, access to food, access to healthcare, stress and anxiety, impacting the well-being of people. And finally, the frontline workers worked under tremendous pressure and they faced a number of challenges in their roles. Thank you.
Thank you very much, Alok and Vasudha, for presenting. Clearly, the frontline workers have been our heroes, COVID heroes. PFI made a film on the role of frontline health workers, and nothing PFI has produced has made the kind of figures. Millions are watching every week. The figure increases by 1 million, and clearly everybody knows the role of frontline health workers, but you have further reiterated that. I'm now going to come to Nitya from Dasra. Nitya Deranani, that will be the 4th presentation. She leads the Thought Leadership Initiative of the 10 to 19 Dasra Adolescents Collaborative, and she will be presenting their study on experiences of civil society organizations working with adolescents. And like Quilt, Dasra, we do partner with them in other areas, but this study has been done by Dasra. Nitya, over to you.
Thank you very much. Thank you very much for that introduction, Poonam. It's certainly a hard act to follow the presentations that have already been done, but I will do my best. Dasra's research in this area is slightly differently pitched. Our research is focused on understanding the experiences of adolescent and youth-serving organizations in the face of the pandemic, and through them, the experiences of the young people that they serve. We've done this through an online survey. We've worked with the 10 to 19 community of practice, a community of organizations all together working on adolescent issues. And we've looked at a broad range of topics, including education, livelihoods, mental health. For the purpose of this presentation, we focused in on a few of these in the interest of time. But broadly, when we're looking at understanding the experiences of these organizations, we're looking at 3 things. We're looking at understanding how many organizations have received reports of 1 or more young people experiencing certain outcomes, certain difficulties. We're looking to understand whether this is at an increased rate since before the lockdown. And we're looking to understand what actions that organizations have taken and what recommendations they have for actions that can be taken in the face of these difficulties. Diving straight into results in the interest of time, I think it'll surprise no one in this audience to recognize that the imposition of the lockdown has had an impact on the education outcomes of young people in this country. While 75% of organizations have reported that some effort has been made to have online classes or distribute study material for self-study, it's still a concerning statistic because 80% of those organizations reported that only some of their students had access to acceptable devices or the network that they need to be able to access those materials, with therefore, of course, leading to concerns in terms of reach and accessibility for our most vulnerable and most marginalized. The impact that this can have, it can be quite long term. There are also fears of forced school discontinuation, especially for young girls, with 43 instances of girls parents planning to withdraw girls from school permanently even after the lockdown as a result of this stoppage of their education in the short term. When it comes to findings related to safety and violence, safety and child marriage, a quick note on how to read this data. We've provided two numbers across the slide. The larger number across each of these graphs is the total number of organizations that have reported experience with a certain type of incident, while the smaller number
What happened? Sorry, we are having, I think Nitya is having connectivity issues. So she's back? Okay, Nitya.
I'm so sorry about that.
That's fine, go ahead.
Our new normal indeed. Diving right back into findings related to safety, violence, and child marriage. A note on how to read the slide. We've provided two numbers. The first number is the total number of organizations reporting an experience with a certain type of incident, while the smaller number is the number of organizations who have reported experience with that incident only since the imposition of the lockdown. I think most concerning of these is if you look at the statistics for domestic violence, while 56% of organizations have had young people approach them with concerns or for support in dealing with domestic violence in the home, almost half of those, 25%, have only seen that since the lockdown has started, which indicates quite a significant increase. Similarly, for underage marriages, right? 33% of organizations have been approached about at least one case of an impending underage marriage, but one-third of those, or almost one-third of those, or around 9% of organizations have only seen this happen since the imposition of the lockdown. Similarly, we have concerning statistics when it comes to mental health and access to other health services as well. When it comes to anxiety, 76% of organizations have been approached by at least one young person, talking to them about feelings of fear, panic for their future, anxiety about what's going to be happening to them. 2/3 of those organizations have, again, similarly only seen this since the imposition of the lockdown, understandably so. Similarly with, and I think we've seen that through Angad's presentation a little bit earlier as well, similarly we've seen increases in access, increase in difficulty in accessing health services across almost all of the services that we were asking about, including sanitary napkins, contraceptive supplies, and pregnancy-related services. Really quickly, I'll go through into, I think, what we found as the conclusions or the recommendations of this data. What we also did through this study is we focused on asking these organizations, who of course are the first resource for a lot of young people in experiencing these difficulties, for recommendations of what can be done. I think what has been very clear to us is that counseling needs are acute. There is a huge amount of investment needed in developing and running telephonic interventions to reach these young people. Similarly, there is a need to double down on existing platforms. Really make sure that we are using the adolescent-friendly health centers, the AFHC counselors, the peer groups that already exist in the community to make sure that we are providing a supportive environment for adolescents to be able to work through these, to work through some of the challenges that they are now facing. Another thing that is absolutely key is making sure that we are engaging gatekeepers and the frontline in working with young people during this time. It is critical that parents are on board when it comes to making sure the intervention is lasting and that we are able to stop distressing school discontinuation for girls or stop child marriage as well. It is also critical that the frontline workers in communities are well equipped to understand and prioritize the risks that young people face, especially given the widespread use of technology to reach these young people and the new environments that they are being exposed to digitally. it is clear also that there is a responsibility for us as a community of civil society organizations to innovate in how we reach more people, whether this is about innovating in terms of how we digitize curricula to make it more accessible for the unreached, or whether it's about doubling down to restore the supply of sexual and reproductive health services and products. There is innovation that can be done to plug the gaps in the supply chain for these services. And I think that that is where a lot of organizations have turned their attention to. Finally, least but not last, it is critical that we continue to look at this issue with a focus on making sure that we have gender disaggregated data available to understand how young people are experiencing this pandemic, because without that information, we're operating a little bit in the blind. So this, in a nutshell, is what I think we have found.
Thank you.
Thank you very much.
Thank you, Nitya. This is very valuable, the experience of NGOs that you have collated and shared and made the recommendation. 76% anxious young people not in school is very disturbing. The data makes it even more disturbing, even though we knew there is a huge amount of anxiety on a range of issues with young people. And absolutely, gender disaggregated data has to be tracked. So thank you very much. With that, we complete the 4 studies, and all have looked at the issues very widely and truly focused on adolescents, programs that we need for adolescents in addition to what already exists. The studies have also shown us that the opportunities to respond to the emerging priorities for adolescents and their well-being. I am confident that the recommendations emerging from these studies will help us in defining how to address needs and aspirations of young people of India. And I am delighted to see amongst the participants, policymakers, donors, academics working on these issues. And I hope together we will combine our energies and synergies. With this, I want to invite my colleague Seema Chishti, who you all know as a well-known journalist who joined PFI as a senior advisor, and we are taking advantage of her as soon as she's joined us. Seema, over to you. I do want to say that I'm sure we have shared, Seema, the studies, as you know, earlier with Mr. Agnani, but I'm sure he will have questions apart from the questions you have to him, and I'm sure there will be time to do that. Thank you very much, and over to you, Seema. You are in one of the rooms in the office, right?
Correct. Thank you so much, Poonam, and a very good evening to everyone. It's been a very enriching session, and I think there is a lot to chew on, perhaps too much. But because we have a panel of very eminent people who worked for several years in different capacities on adolescent health and well-being, so I hope they'll enable us to kind of negotiate this terrain and tease out some of the threads of a very complex, interesting set of numbers, data, and information inferences that we've heard today. So I would like to first introduce the 5 panelists to you. It's an honor to have Dr. Manohar Agnani, who's Joint Secretary, Reproductive Child Health, Ministry of Health and Family Welfare, Government of India, with us to discuss the findings. We have Dr. Eric Munro, who's Director, Evidence Measurement and Evaluation with Children's Investment Fund Foundation, or CIF in short. He's in another time zone, but I think we're in good order to say good afternoon to Dr. Munro and thank him for taking time out. Mr. Manak Matiani, the Executive Director of the YP Foundation. Welcome, Manak. Mr. Kanish Kabiraj, who is country lead and one of the founding members of the Girl Effect India, where he's responsible for the implementation and development of Girl Effect's India programs. Thanks, Kanish, for agreeing to be part of the panel today. Ms. Poonam Matreja. Poonam is the Executive Director of Population Foundation of India and has worked in the fields of women's health, reproductive and sexual rights, rural livelihoods, public advocacy, and behavior change communication for more than 3.5 decades. And thank you for agreeing to soldier on despite having steered the presentation of the studies in the past hour. So I'm hoping to kind of keep this quite simple and allow everybody to have their say and to reflect on the findings in the first round, as it were. And of course, if we have a little bit of time after that, it will be good to do a little quick second round. And I would like to kick off, if I may, with Dr. Agnani. So the 4 studies presented today have brought out some of the challenges that the young people are experiencing in accessing information, and services related to their health and reproductive health, nutrition, and sexual issues, and also some opportunities for improving their health and well-being. So how is the government prioritizing their issues? What actions, Dr. Agnani, have you been able to take to make their lives simpler?
Thank you. How much time do I have? 2 minutes?
How much time do you want? No, you have more than 2 minutes.
So maximum
about 4 minutes?
4 to 5 minutes? Yeah. Thank
Yes.
you. Thank you. And excellent presentations. We call it in Hindi, Gagar Mein Sagar.
Wow.
So these Sangamitra, Dr. Anand Chaudhary, Alok Vajpayee ji, Vasudha Chakrabarti ji, and Nitya, of course, they made excellent presentations. So I confess that the COVID-19 has biggest impact on healthcare because all possible resources were tried to be pulled in and to minimize the impact of the COVID-19. That's one. And also healthcare providers and community health workers were at the forefront of managing these crises, as was outlined in Vasudha Chakrabarti's presentation. Can you hear me?
Yes, yes.
Yeah,
yes.
so I thought Eric is not able to, so yeah. So as was very well reflected from Vasudha Chakrabarti's presentation as well. But let me tell you that adolescent health issues, and also we understand that younger people are generally perceived as a healthy age group, and thus the low focus is given on their health needs by the community as well as the systems, I would say, as well. But now, let me also say with confidence that adolescent health issues are so based on these 3-4 studies, which have actually reflected on 3-4 major challenges. One is about sexual and reproductive health services. Second, they have touched upon the mental health. And third, of course, the gender-based violence that has emerged from these studies, which were shared for across 5, 6, 7 states, which they did, and also the CSOs of 111 or so experience. So let me be very clear that I understand that adolescent health is a priority for us, and their health needs are unique. And we need to ensure what is emerging from this, and also within the internal discussions and with the program divisions also, we understand that access to SRH and services, including safe abortion services, is important. Access to health information from reliable sources is also very important. Access to commodities, which were pointed out here, IFA, contraceptives, and sanitary napkins also, that's very important. And of course, the mental health has very well highlighted, so that's also we need to work upon. Before going to what we are trying to do, not because I'm representing ministry, but being with the public health background and some research background, I would like to understand in details, because I was under the impression that out of the services which were reflected in Vasudha's and Alok's presentation on VHND, ANCs, immunizations, PNCs, nutrition and health products, I largely would agree with the findings except the immunization part, because that's something which we have been strongly feeling that has not affected to an extent which is being shown here, but I would be very happy to understand it more. And Odisha, of course, as you said, that they from the day one ensured that the health services are essential health services are continued irrespective of along with the management of the COVID-19. So that's one thing. And of course, the other states like Rajasthan, Bihar, Uttar Pradesh, and Jharkhand, they have been shown on the different scales of the service provisioning. So we realizing all this, that it may impact on essential health services, we started proactively, and you know that we issued the essential guidelines and maintaining the essential health services, and be it getting the additional HR or additional resources or additional methods of training or additional methods of service provisioning, everything we try to bring under that essential documents. But now coming again to these studies which have been pointed out, and understanding the time constraint, let me tell you on mental health, we are actually, with the support of TIS, we have done the webinars, have been conducted in orienting our state program officers who are dealing with the adolescent health on the impact of COVID on adolescent and mental health issues. So I will get just 2 more minutes. I'm getting the buzzer. And secondly, ministry has also collaborated with the NIMHANS and IQVIA for skill building of adolescent health counselors on providing psychological support to adolescent and young people. And third, very important, which was highlighted here also, that's I must say that's something which we are thinking largely is also we are trying to engage with the youth networks like YP Foundation, and for engaging community-based youth champions and youth networks for creating positive environment around mental health issue. That's very important. Then for ensuring services, as I said, that we have issued the directions and we have said that all adolescent friendly health clinics should be working normally. Outreach activities by counselors and the peer educators should come to normal, and distribution of IFA and sanitary napkins and contraceptives should be ensured. Now, having said so, we also need to identify and further explore the alternates, as have been said in this study also, and we also strongly feel with the new normal. So how can we best use the technology? That's one part, using telecounselings or telemedicines, mobile applications, IVRS, chat box, helplines. So much has been suggested here. We are open to that. And also convergence with the other departments and the CSOs. That's very important, because the alternate delivery mechanisms has been very strongly being pointed out. I remember Sanghamitra was referring to that, and probably Nitya also hinted at that. So what could be those alternative delivery mechanisms, although we are strengthening our own systems? So one new initiative could be that, can we think of working with the same presenters who have done the study and giving us the alternate solutions. So along with the strengthening the routine services, that's one thing. And just in the end, I am also wanting to just introduce a new initiative which we have done, maybe not very relevant here, under the school health program. That's Ayushman Bharat School Health and Wellness Ambassadors, where we are trying to cover creating the health and wellness ambassadors, the teachers, and through them the students becoming health and wellness messengers. There are 11 themes. I won't name all of them, but there is a focus on growing up healthy, also trying to cover the emotional well-being and the mental health, interpersonal relationships, promotion of healthy lifestyles, reproductive health is of course there, safety and security against violence and injuries, and promotion of safe use of internet media and social media. So I stop here, and I would welcome all the organizations who are working on this to partner with us. We are open to all the discussions, and we understand that we need to work on this important aspect. And thanks for making excellent presentation and giving me opportunity to speak on this. Thank you very much.
Thank you, Dr. Agnani. We'll get back to you again. It was very reassuring to hear of your emphasis on mental well-being, on the young ambassadors, school ambassadors, counselors, and to being open to all alternate technology and ways of reaching out to people. I'd like to go on to Ms. Poonam Matreja. Poonam, what the Population Foundation of India study finds out, which I think is the most striking thing, is the fact that there's a distinct gender dimension of COVID-19, which we all acknowledge even anecdotally, which we see see that women are more impacted by it. I want you to talk to me about and talk to us about how is addressing the women's question going to be of benefit to all of humanity? Or, how is that the golden key through which we can lock this very difficult COVID situation?
I would love it if you would call women the golden key. To look at the 6 countries, it's a political comment, but look at the 6 countries that have done the best. They are led by women. Germany, many other countries. So that's a message to everybody on leadership. But I do want to say here first that, it was very disturbing for us to find out. And in fact, it was a very quick note Sanghamitra did for us within PFI when we started looking at COVID as an organization when the lockdown happened. And the first thing, her note that she did for us, we asked her to look at global evidence, data, what is the best way PFI can contribute. And I can never forget that line that she wrote, and it was in her first paragraph, that only 1% of the research after Zika and Ebola was gendered. There was no disaggregated data how it impacted women. And yet later on, we saw, again, the same things happening during then, violence, domestic violence increasing against women, domestic violence, girls dropped out of school, the numbers are huge. And so therefore, given that, it is very important that not only we collect gender disaggregated data, but we also have policies and programs that mitigate. The mitigation of COVID must have a strong focus on gender. And then when we are talking about gender, a strong focus on adolescents, both girls and boys. If boys aren't in a good mental, physical health and are very anxious, it's not going to help us as a society, because much of the violence and decisions that go against gender, I'm afraid, are made by the father and the brothers and the men in the family. So we need the men in our families, in our communities, in our country, in our leadership, in very good mental and physical health and less anxious, because the anxiety turns against women in a big way, as we've seen across these studies. We have, I'm not saying this, I'm not saying what I'm about to say. We have, in the health ministry, we have strong gender support. And I'm not saying this because Mr. Adnani is here. I say that behind his back. If you read his work, even his poems and books, there is a very strong gender dimension. And I mentioned last time that 2 of his family members work with NGOs that have a strong gender, reproductive health, violence, sexual abuse focus. And I know how supportive he has been of gendered response, not after COVID, but also before COVID, as PFI has had the privilege of working, as many of you have had the privilege of working. So we do have a really strong possibility of sharing research with this government, with the ministry, where we know that the people there are going to listen to us. So therefore the importance of sharing these studies today with Dr. Manohar Agnani and his colleagues. I know that Jaya Rizvi, Dr. Jaya Rizvi, and as well as other people are on this in this meeting. Second, I'd like to say that the vulnerabilities that women and young people, particularly young women and girls, have experienced, and the disruption of social and protective networks and decreased access to healthcare services, especially reproductive and mental health services. It is something that we need to work together with the government. And I absolutely welcome Dr. Adnani's suggestion to work on solutions. I think the time is gone when we should just be burdening this overburdened health ministry dealing with this pandemic with problems. I think we need to, even without Mr. Agnani asking us, we should be going with solutions as everybody has done today, but we need to do a strategy and think out of the box and work going forward. And for me, this is the best outcome that the two studies we did and the studies that others are doing bring out. Third point I'd like to make is, when we are talking about gender, looking at the frontline health workers and not just admiring the enormous contribution they made, but how do you strengthen the frontline health workers? And how do you work with government on strengthening, whether it's training, whether it's other needs that they have? I think it's not just the responsibility of the government. They may be frontline health workers, but they are the real people's workers. They represent the people. And I think we have to find, all of us have to worry about them. And they're all women primarily. There are 3.3 million frontline health workers, which includes ASHAs, ANMs, and Anganwadi workers. And I do believe that if convergence, which is something that women deal, if I may say so, often better with than the other gender. I have seen in UP where it's called a AAA program, ASHAs, ANMs, and Anganwadi workers, the three ACEs have done brilliantly at the community level on in an integrated approach to care of women. Finally, in the community and adolescents are less hesitant to go to the AAA or the three ACEs. But women definitely do go, and that's their only contact with the women by and large. So as far as violence is concerned of any kind, whether it's domestic, interpersonal violence, intimate partner violence, or any other form of violence, I do believe that the health ministry has the biggest role, along with the Ministry of Women and Child Development, which has not only because it has the Anganwadi workers, but health contact is the first contact. And I would really, really like to see and work with the government on a strong public health response to violence. And I'll end there. My time is over.
Thank you so much, Poonam. I think the AAA is like a thought, and it's more than a thought. It's kind of just tells you about how much of good things that synergy can do to alleviate the crisis. I want to move on to Mr. Manak Matiani. In the studies that we heard, the young who have the major part of their life ahead of them seem to be quite concerned about joblessness and unemployment. And that is more than just a personal crisis. It's an economic crisis. Of course, it's a personal crisis. And it's also heading into almost becoming a social crisis. So I want to understand, Manak, how do you sort of see that kind of a problem and youngsters navigating it?
Thank you so much. I mean, I would just like to say, I don't want to repeat the data that has already been presented, but I would absolutely corroborate all of the insights because they match what we are finding from talking to young people. And as is clear from the fact sheets, education and employment, the interruption of both those things, the low interest that the Quilt study is saying in vocational training, in skilling, all of that is very concerning because as you see, and taking from what Poonamji was saying just right now, the impact of education and employment disruption is also gender. So while men are more worried about not being able to find jobs, women, the impact that we are seeing on young women and girls is at the level of aspiration. That even the aspiration to be able to go for employment has now changed because they know that they will be the ones who will be burdened by domestic responsibility. And I think that's something that we need to really, really highlight when we are talking about employment, because otherwise it will just go into this whole bubble of talking about skilling, vocational training, and the kinds of responses that we have also had have been about, labor laws and stuff, which are not systemic in nature. And there, I think, is something that we need to focus on, that there has been a whole bunch of work done with young people, with young women and girls, on making them able to actually aspire higher, to actually choose employment, to be able to disregard marriage as an obvious choice. And all of that work will now take a hit because of this situation. And that's something that is really significant and jumping out at me when I saw the fact sheets and the studies that were presented. I think the first casualty of disaster usually is the aspirations of young women and girls. And we've seen this very directly in the communities where we work, where, going back to school, or just like when you have to make an economic choice for the family, it is going to be the future aspirations of the girls that will be put on hold. And that's happened for many families in cases where they just needed money and rations during the lockdown. And so that's something that we need to keep in mind as we move further. So that's on the employment question, I think a very, very important one. And I think, again, this whole loss of employment equal to loss of self, or a loss of a sense of selfhood, because for young men, a whole sense of selfhood is constructed around how productive you are in the workplace, and therefore you are able to hold a family together. So this whole link of employment with masculinity, then leading to a gendered impact, then leading to an impact on how violent their responses might become, is something that we also need to study more in depth as we go along with this situation, and something that we are doing, and I would recommend for others to do also, is to look at how this very different kind of role we saw initially. Felt hopeful that men will now be doing things at the home because they are in the homes, but we saw that that did not happen. And so, it's also important to get a clear picture of what happened. How did the home space get further, divided based on gender, even when all people in the house were in the household? Within this gender question is also the question of employment for trans young people. And that's entirely missing. That has been a big missing link in education and livelihood work in general. And I think now transgender communities, transgender young people who are much more vulnerable to violence, much more susceptible to homelessness, much harder for them to find jobs. I think that is a community that, again, many of these crisis and long-term relief interventions and responses are still leaving out. So I would like to really bring that squarely into the mix as well, when we talk about employment opportunities and the long-term repercussions of that on young people.
Okay, thank you so much. I think that was very useful. Kanish, Kabiraj, technology has been central and has been discussed a lot in how technology has enabled, humanity to navigate COVID and the crisis. And the study presented by Quilt specifically spoke of how young people and adolescents were using digital media and social media. What lessons in the use of technology has COVID given to us when it comes to communicating with the young, you think?
Thank you, Seema. As I reflect on some of the things shared today and the work that we are doing at Girl Effect, not just in India, but globally, I think I'm just confronted by the scale of the problems that we are facing today. But at the same time, I think, as Angad hinted, there is always a silver lining in terms of the people who are joining in droves now. What we would consider a fully participatory digital environment. And I just want to touch upon three things. The first one is that I think now is the time for us to truly leverage private-public partnerships. I think Dr. Agnani spoke about the fact that there are alternative delivery mechanisms that are emerging. I think Ms. Poonam talked about the fact that we need to support frontline workers. I think all of this actually comes together in some of the work that we are also seeing in our conversations with private telemedicine and telecounseling providers, as well as thinking about what the government is already offering. I think ensuring that we are pushing hard enough to think about how the new generation and new body of people who are joining digital, who are very vulnerable, can have access to the best of digital. I think within digital now, there is such a caste system in terms of what people can and cannot access. The digital is no longer one thing. It is representative of many, many different meaning systems and worlds already. And I think it would be a shame for us if we replicate all the evils and norms of the offline world in the same way. So one of the ways that I can think of, for example, is how do we ensure free counseling, free helplines that are accessible, that people can turn to, and particularly in our experience, it is linked to the second thing that I wanted to talk about, which is the culture of silences and its correlation with a time of crisis. During times of crises, everyone hunkers down to make sure that we're all doing the best for the family, that we're not speaking out of turn, that we're not asking for too much, that we're not making things difficult for people and for the community. And I think this leads to cultures of silence that already exist for a gender that is often on the margins in this country. We don't want to exaggerate that. We don't want to make people who are already nervous to speak up and ask about simple things like pads to feel nervous about the fact that they need to now ask for these things. They need to challenge the fact that access is not available. If the local clinic or the local chemist doesn't have pads and isn't talking loudly about it, that should be a problem. We should make a noise about it. And I think making sure that we're acknowledging that having a voice is not wrong, saying things is not wrong, is linked to, I think, some of the conversations that we were talking. I think Mayank touched upon it, that so many correlations exist that we can't ignore them. We have to acknowledge that if we champion the voices of girls and if we champion the voices of young women, that will lead to a flowering of taking care of other things. We will be able to take care of, they will be able to take care of themselves, and in doing so, they'll be able to take care of those around them. I think the third thing that I want to touch upon is it's often that we think of digital as innovative and alternative. I think we are now well past that period, and I think the opportunity is much larger. It is a critical opportunity for us to do what I think the government already recognizes, which is how can we use digital for connecting and accelerating change at scale, and making that one of the main ways in which we think about change and countering the crisis. So not just the dissemination of information, but actually making sure that we are thinking about WhatsApp groups instead of booklets, that we're thinking about how Ashas can connect together in terms of self-help groups that they can find. The video spoke about them sitting together. Can they sit together virtually? Can we enable those and think about those ways and not think so much about a digital divide anymore, a digital and not see these two worlds as separate, because I think that is the main thing stopping us from moving forward.
Yeah.
Thank you
so much. That was very thoughtful. I'd like to bring in Dr. Eric Munro into the conversation. So Dr. Munro, how can we change the way we evaluate our programs to be able to capture the impact of COVID-19 and the utter, disruption it is bringing on young lives?
That's an interesting question. I think before I start, I do want to take a moment to thank everyone who's been presenting and participating. Being at a donor like SIF, you're more of an enabler in these situations, and hearing the experiences and being able to talk to people who are on the front lines really delivering services and delivering impact is a real honor. So thank you all so much for your hard work, not only over the past 4 months, but in general as well. So in terms of how we're able to capture information, to be able to act over the course of a pandemic like the COVID one, I think there's a number of changes that we have made and we're considering making as well at SIF, working through, of course, our partners and grantees. One is a shift towards collecting information more routinely, making sure that it's not just survey-based approaches that we're using to be able to capture information, but trying to capture things in existing data systems that are already having touch points with people every time they're accessing services or other sources of information, the internet, and so on. There's a great deal of things that can be greater leverage than they may have been in the past. And perhaps even being smarter about the way that we're using those, so that we're not asking every person every question, but making sure that we're creating as light a burden for people as possible by asking kind of randomized sets of questions within routine data systems where those are capable to be able to maximize the information we're getting and how we're able to act upon it because of the granularity and timeliness of it without necessarily needing to hold big surveys. Where that's not necessarily possible, we have been looking at a lot more remote data capture. So things are shifting more towards phones or other points of contact, like contact centers, for example. We've seen big increases of the utilization of contact centers at several of our grantees, where some of them have had 4 times the number of calls since coronavirus started. But where we are doing remote data collection, first we've had to look at the feasibility of that. Are we able to actually reach the demographics that we are trying to understand? I think it was Poonam who was mentioning the gendered aspect of the pandemic, and this is something that we've seen in numerous epidemics before, so making sure that we can focus on getting information from really key groups. This is, of course, something that once you move to remote data collection, perhaps a bit less so in India, where you have a lot more mobile phone connectivity. But in many parts of the world, women and adolescents are far less likely to have access to phones. People in lower socioeconomic status are, and we need to find ways that we can overcome this bias. So some of the things we've been exploring while we're doing remote data collection is to use existing data sources and compare the data we're capturing remotely to those and see what sort of bias there might be in there so that we can try and correct for it. Using things like respondent-driven sampling, because we may not have comprehensive lists of phone numbers to be able to reach people directly, and by leveraging the information that people themselves already have, we might be able to capture more. And I think there are also a number of concerns when doing it that we need to make sure that we're cognizant of as well, protecting people's privacy, particularly around sensitive information that they may be sharing. So we've had to make sure that we're talking to the people we think we're talking to, sometimes using additional information that we may already have on them. Even things like voice recognition is on the rise, we're seeing. But also making sure that they have a private place to talk. And for people who aren't able to be contacted that way, perhaps leveraging existing things like some of the door-to-door information collection or information provision services that have been going on over the course of COVID. I think we also need to think about some of the threats to validity in doing research during a time of pandemic, to see that if we're trying to assess not just the pandemic itself, but the impact of a particular project, the timing of when you're gathering evidence could have the potential to make you either see that you're having an impact that you may not have, or that you're not having an impact when the project may have actually been quite successful, because what you're measuring is more the impact of the pandemic than the project itself. In terms of trying to assess things around coronavirus itself, CIF had a quite extensive discussion near the beginning of the pandemic to see whether we really wanted to shift money and funding to trying to address the pandemic. And we have done that to a limited extent, but for the most part, the conclusion of that discussion was that what was really critical for us was to double down on the types of things we were already funding. For those of you who don't know, CIF funds a quite wide range of investments, from climate change, where we've seen strong increases in deforestation and illegal forest extraction. I mean, in Nepal, it went up 220% in the first month of lockdown. So there's clearly a lot of issues there. I mean, many of the previous presenters have mentioned some of the health ones. We see issues on gender, on children, on human capital, on opposition taking the opportunity to exploit the situation and try and increase restrictions on women's access to healthcare. And so in all of these things, we've kind of made the decision that we really need to actually refocus and re-emphasize the work we were already doing to make sure that the epidemic doesn't have as extensive an impact as it could, as I think someone mentioned before during some previous epidemics like Ebola. There have been increases in many maternal deaths, neonatal deaths, and we're trying to invest in limiting those. So we haven't been directly capturing a whole lot on impact of COVID itself, but more its impact on the types of services that we have typically been delivering. And it's mainly through those routine and remote ways of capturing information.
Okay, thank you so much, Dr. Munro. That was like a very interesting way, enabling us to reimagine the whole idea of a survey and how we do it. I was hoping I'd have the luxury of a second round of questions, but I think I clearly don't have that time. So before I hand back to Poonam for the closing note, because the role of government has come in several presentations, and there's been talk of a partnership which Dr. Agnani himself spoke of, and as did many other panelists. I'd like to throw this open again to Dr. Agnani very briefly, particularly as the pandemic is kind of, entering from a metro space into the more non-metro areas of India. What are the challenges, and what is the kind of door for a partnership between civil society organizations and government that you see opening? Very briefly this time, I'm afraid.
Yeah, so this is a difficult question in the sense because we need to have a lot of understanding of this, we call it new normal COVID phenomenon. So I have a public health background. I even don't understand how it is going to behave. So what are the solutions available to us? And that's entire country and the world is struggling with those questions. So of course, yes, we don't know how far it is going to penetrate to the rural areas. Do we have surge against in the urban areas? How long we will have to live with this? Is it going to be the new normal? Do we need additional HRs? Do we need additional capacities? But definitely one thing is that we will need to change the functioning differently. So we will have to focus more on IT-enabled solutions. We probably have to do trainings, capacity buildings using these platforms. You will have to actually create some more HR for bridging the gaps. And of course, you will need more resources. Once it moves from urban to rural, that's the question which you wanted to ask, then of course, yes, I would say that the burden on the healthcare professionals will be the same as they are facing now, because most of them are already working in these difficult times. So the best thing is that how we can consolidate our efforts, pool the resources, find the alternate solutions, innovative solutions, and with the goal of bridging the gaps with the equity lens and ensuring essential basic health services available to all. Thank you.
Thank you so much, Dr. Agnani. And with that, may I thank all the panelists for their patience, fortitude, and insightful comments. And may I hand back to Ms. Poonam Mutreja again to just do the closing. Thank you very much.
So thank you, Seema, for really doing a great job of that moderation and finishing on time. But by giving us extra time in the first round, it was very helpful. I thought it was helpful rather than, on today's television channels when you're stopped and you're beginning to make a point. So thank you for being considerate. Clearly, investing in health workers, and especially what's come out is helping and investing in the 3.3 million frontline, strong workforce of women frontline workers in the aftermath and combating COVID-19 is a great investment. Investing in mental well-being of all is probably requires an emergency relief response. And I believe, again, the onus is on civil society and others to come out and do partnerships with private, public, and with government. And there is a huge need and opportunity that COVID has sadly provided us to use technology as people are changing the way they are communicating, gathering information, as we saw today, adapting to new behaviors. COVID-19 and the resulting lockdown has encouraged, clearly has encouraged PFI to do a lot of SBCC programs, to take a digital first approach, and looking at leveraging the multiple increasing digital platforms available to reach audiences. Going digital with SBCC is the future. And Mr. Agnani also said at the end that, using digital technologies is very end of his first intervention, very important. And so now I'm going to assure Mr. Agnani and Dr. Zoya Rizvi, who has also joined us. She is part of the leadership in the adolescence program in the Ministry of Health and Family Welfare. I assure you that we will do our best to support you with a plan and ideas in collaboration with the partners. And I want to thank you for your presence, and I want to specially thank Venkat, my colleague, Francesca, Ria, who have led this workshop, and clearly Venkat put in a lot of planning and hard work, and my other colleagues who've done all the work and given us this opportunity. Normally we would have hosted you with high tea at this point of time, but wo udhar rahi. We will hopefully come to a stage where we can all meet and have a good evening. Stay safe and stay healthy. Thank you very much indeed. Thanks to all the presenters, of course.